today we're going to go over the Arizona Association of Health Plans AzAHP credentialing forms. We encourage providers to become familiar with this particular section when submitting AzAHP credentialing forms to the network management box. The next few slides are going to provide an overview about how to identify the correct form. We're also going to go over some specific trends that we've seen with provider submissions, so we can identify areas that typically we see errors that can cause the applications to be returned. We're going to also review the insurance requirements and go over some additional helpful tips to ensure that you have successful submission. AzAHP credentialing form. There is a new AzAHP practitioner data form and a new combined AzAHP organizational facility form effective October 1st. The old forms will no longer be accepted, so you can find this new form on the website, mercycareaz.org. Under the insurance plan, you're going to select the For Providers tab and then Provider Forms. This new form can be identified with the footer Revised 2021. We do not accept any of the old forms, so make sure that you are identifying if it has that. If it does not have that, then it is an old form and it should not be used. MercyCare reviews all submitted AzAHP practitioner data forms and AzAHP organizational facility applications to ensure that each form is filled out completely and to validate data fields. So if all the fields are not filled out, it may cause the form to be sent back. We also do not accept pending or same as above, so it's important that you fill out all fields in their entirety. Many forms are considered incomplete because they are missing information and are emailed back to the sender, which then delays the processing and ultimately the credentialing process of your practitioner, organization, or facility. The next few slides that we're going to go over, we're going to identify some examples of why most forms are returned. The first field we want to call your attention to is the CAQH number. It must include all 8 characters. It can be a combination of letters and or numbers. The access ID must include all 6 numbers. If the form is the AzAHP practitioner form, make sure that you're using the practitioner's access ID. If it is the organizational facility form, make sure that it is the access ID for the organization or the facility. The next field is the patient age range. We want to know what age range that your agency sees. For pediatric, in this field, you're going to put 0 to 21 if you see pediatric. If you see adults, you're going to put 18 to 99. If you see all ages, then you're going to put 0 to 99. The next field is the patient gender. We want to know what genders that you see at your office. You must specify if it's male, female, or both if you see both genders. Next field that we want to call your attention to is whether or not you participate in VFC, Vaccines for Children. Vaccines for Children participation is required for all PCPs that treat pediatric children 0 to 18. We'll also need the VFC PIN code, and it must include all 4 numeric digits. The next field that we want to call your attention to is the patient-provider office hours. It must specify the days worked at every service location, and it should be the hours that the provider works, not the hours of operation at the facility. So, for example, if your office is open from 8 to 5, but the doctor works from 8 to 3, you should specify 8 to 3, not 8 to 5, since they are not there for those last 2 hours of the day. If the provider works regular days and hours, the documented hours of availability cannot overlap if they work at multiple locations. So do not include Monday through Friday, 8 to 5 for all locations. It should be specific to which location it is that they're working. And you should only list locations where they actively provide services. It should not be all locations that belong to your organization. It should be only the ones that they actively work at. The payment for these covering providers is based on the TIN. It's not by the location. Any provider can physically render care to members at multiple locations at one time, so it's important to reflect those different hours worked at each location. The accuracy of this information is especially important for our members, and it will be displayed in the provider directory, which does get audited by Access, so it's important that those stay current and up to date. The AzAHP credentialing form also has a field that requests your license, state, expiration date, your DEA number, and XDA number, and its expiration date. All licenses and registrations must be current. Do not submit applications with pending or expired license or registration. The next page we want to call your attention to is the cognitive and physical disabilities accommodations page. You must complete all pages of the assessment for each location. You indicate which location that the information is for by putting the address in the address field at the top of the form. If the accommodations are the same for all locations, you can just put all, but do not leave it blank. If it is left blank, it will be sent back. We cannot assume which address the information is for. Next thing we're going to go over is the AzAHP credentialing form's insurance requirements. The AzAHP credentialing form includes a checklist that outlines the different access insurance required language and minimum amounts of coverage that must be included in the commercial, general liability, personal liability, business automobile liability, and workers' compensation and employer's liability policy and certificate of insurance. For the endorsement language, it is required for both the commercial general liability and the business automobile insurance certificates. Do not submit blank endorsements. The endorsement language that is required is the state of Arizona and its departments, agencies, boards, commissions, universities, officers, officials, agents, and employees shall be named as additional insureds with respect to liability arising out of the activities performed by or on behalf of the contractor. It's important that the language is verbatim. This is the required language by Access. Next section that is required is the waiver of subrogation language. Waiver is required for commercial general liability, business automobile policies, and workers' compensation and employer liability insurance certificates. The language that must be included is the state of Arizona and its departments, agencies, boards, commissions, universities, officers, officials, agents, and employees for losses arising from work performed by or on behalf of the subcontractor. The next requirement is sexual abuse and molestation coverage. SAM is required for commercial general liability and professional liability insurance certificates, and the language that must be included is sexual abuse and molestation coverage is included, or sexual abuse and molestation coverage is not included. You're going to want to use this checklist on the application to ensure that all the required language is incorporated in the submitted certificates of insurance. That required language is the minimum amounts of coverage are required and need to be on there. The Accord form is a universal form that summarizes the policy coverage and coverage limits. We ask that you use that form. It makes it much easier for our credentialing team to review and make sure that all the required minimum coverage and language is on there. And we recommend sending the example required language from the form to your insurance contact so that they can review it and make sure that it's included accurately. The AzAHP credentialing form, we have some additional tips that we'd like to review. First thing is that these AzAHP credentialing forms are official documents. Mercy Care cannot alter provider submissions. If the document is returned for missing information, you should make sure to edit the form and submit it with all documentation as a completed packet. Please do not send it piecemeal. If you send information back, we need you to send everything together. Don't just send the one item that we asked you to fix. We need the entire packet because we do not hold on to incomplete packets. Ensure that all information on the AzAHP practitioner data form or the AzAHP organizational facility practitioner application matches the access provider registration. The following slides are going to outline the required information for each of those applications. The required forms for the AzAHP credentialing form. For the AzAHP practitioner data form, we ask that you also include a copy of your IRS 941 voucher or accurate W-9, a copy of your board certifications if applicable, a copy of the date of board certification examination. If not board certified, provide documentation of CMEs. You'll also need to include a copy of your certificates of insurance information that we just went over that include the minimum requirements. You can see page 6 for the insurance requirements checklist and page 7 and 8 for the complete details regarding access insurance requirements. For the AzAHP organizational facility application, we want you to include the current state license and or business license for each location if applicable, the Medicare certification letter, the CLIA certificate, the current professional malpractice and comprehensive general liability insurance policy, the IRS Form 941 voucher or accurate W-9, and for behavioral health facilities, only if you employ behavioral health technicians, BHTs, and or behavioral health paraprofessionals, BHPPs, provide your policies and procedures that outline your process for monitoring, supervising BHTs and the BHPPs. Accreditation and documentation as well is applicable. Again, just a reminder, do not send credentialing information piecemeal. It is imperative that it be sent as a package. I thank you for your time today and have a wonderful day.